Addressing the importance of social connections. That's the goal of a conversation between Governor Janet Mills, the U.S. Surgeon General, and the Director of Maine's Office of Behavioral Health today. Good evening, and thanks for joining us on News Center Maine at 5:30. I'm Caroline LaCour in for Chris Costa.
And I'm Zach Blanchard. It comes after a report from the Surgeon General last year highlighting the effect loneliness can have on public health. That report includes recommendations for governments, health systems, and community organizations, and more. The Surgeon General suggests support for places where people gather, like parks and libraries. He also recommends creating accessible public transportation and family leave to bring communities and families together. The Surgeon General spoke alongside state leaders at the University of Southern Maine today. News Maine's Sam Olson has more.
The discussion focused on loneliness and isolation. The U.S. Surgeon General says loneliness is a public health concern. He says having social connections is essential because too many people say they're actually experiencing social disconnection.
There's no issue that I have found more deeply resonant with people across the country, rural and urban areas in the Midwest and the coast, as this topic of loneliness and isolation.
U.S. Surgeon General Vivek Murthy joined Governor Janet Mills and Maine Office of Behavioral Health Director Sarah Squirrel to talk about how Maine is fostering social connection in a time overshadowed by technology.
And imagine that if young people are saying it's no longer the culture for people to talk to each other. That something has dramatically changed in our relationship to one another and how we communicate and dialogue with one another.
Dr. Murthy says relationships have shifted from in-person to online, which has led to a crisis of loneliness and isolation. He says the loneliness epidemic began before the pandemic, but the pandemic only made it worse.
And I worry that we are at risk of losing a generation of young people whose future should be bright, who should be thinking about what comes after school with great excitement and hope. And I worry that right now many of them are struggling with this sense of being alone.
The conversation also included Maine's aging population and community needs for gathering away from our devices.
Because online interactions and in-person interactions are fundamentally different. We shouldn't think of them as equal. And we all need some degree of in-person interaction in our life for good health and well-being.
Public health that expands beyond taking people's blood pressure and pulse and oxygen levels, but
Governor Mills says in a year when Mainers faced a mass shooting and severe storms slammed coastal communities, it's important for the state to have this conversation.
those occurrences, those things that happened to us, ended up demonstrating what we have in common, demonstrating the innate compassion and humanity of Maine people.
Dr. Murthy says loneliness is more than just feeling bad. He says it's associated with a greater risk of cardiovascular disease and dementia, among other health issues. That's why he says this problem is important to look at now. In Portland, Sam Olson, News Center, Maine.